So there are three common complications that comes from a jam finger. So in 96% of jam fingers, it's not a problem, just mild sprains. We will get you sorted and send you back. But a small minority of patients with jam finger can develop these three complications. A is obviously a fracture. So sometimes the jamming can be so great. So A and B are basically the force is so high that there's a fracture that happens in the bone itself. Whereas, for example, in B, you see over here, there's the force is so high that the joints give way. So different injuries. So for A, right? For A, it's the bone that gives way. So the bone fractures. And for a treatment for that is always, it depends on how severe. If it's really, really mild, we can just cast it up, splint it up, send the patient away. Make sure you monitor every 1-2 weeks, do an x-ray, that the alignment is in place and the bone is healing back nicely. If it's really bad fracture, I would recommend for a surgery to fix the bone in place. That would be the most secure. Right, so it depends how severe it is. Again, same thing for B. So B is a dislocation. A dislocation, an example, it basically happens that there's ligaments at the side of the joints of the finger joints. It's called collateral ligament on each side of it, and the front is called a volar plate this way. So if the force is strong enough, the finger can dislocate this way, or backwards, right? So there's a bit more options when it comes to dislocation. You can just do a manipulation where basically you push the bone back into place. I always recommend for people with dislocations to repair, because dislocation means that one of the ligaments is torn. So eventually, right, there'll be poor support on the side where the ligament has been torn. And at that point where it's torn, it almost always develops arthritis in the next 5 to 10 years. So if you have either A or B fracture or dislocation, typically it may be better for you to consider doing a surgery to repair it. Okay, so and those are the good thing about A and B is they're fixable and easily fixable. Even though some people don't like the idea of a surgery, blah blah blah. I understand, but just one thing to note is it's fixable, right? It may not be 100%, but we can aim for at least 95% and above. Now C over here, how do I point the finger? Here C is what makes me sweat. Okay, the worst complication that one can get from a jam finger is developing permanent stiffness, fixation, contracture, where if left untreated for a long period of time, structures can shrink, structures can shorten. So you can see the picture of the guy on the right of C, right? What happens that his finger has fused joint stiffen up in flexion. So there is a process. It's not just like all of a sudden, poof, you become stiff and you can't move your hand anymore. No, it's over time that is not managed or not managed well, the stiffness can get worse and worse and worse, right? So what is the biggest thing I deal with as a hand therapist, as a hand professional, is that I want fingers, hands, elbows to be able to move normally or as normal as possible up to 100%. And my biggest enemy is actually stiffness. So when somebody starts to develop stiffness, we need to quickly start to arrange for more active management or with hand therapy. And there are ways to solve and manage and stretch out the soft tissues and hardening tissues for developing stiffness. When it's fully stiff, you probably have to do a surgery really, right? Either break a bone or tear it again and set it again. But if it's on the way to becoming stiffer and stiffer, there are things that we can do. For example, I will get you to wear like a static progressive splint. Basically, what it means that I get you to wear something hard, like a splint, like a protection, but the function is to press down and straighten out the joint, which can be worn 24/7, and you take it out once in a while or at fixed time to stretch out the joint, to mobilize the joint. Okay, when it's still early phases of stiffness, there's a lot of things we can do. With heat, with manual therapy, with a lot of stretching, with static progressive splinting, we can still salvage and and help the patient achieve as much as possible. But when it's fully stiff, it's going to be a bit more challenging. But it's still fixable actually, as much as possible. So these are the three common complications that patients can experience with the seemingly non-dangerous jam finger. Again, as I said, 90%, 95% of the time, jam fingers are really very mild. They heal on its own with just icing, protection, swelling management, and checking in for the pain. The more complex ones are these three. A is a finger fracture, B is a dislocation, and C is it progressed and worsened into a stiffness. So they're all fixable as long as you get it sorted out as soon as possible. And if you have any questions for me, just comment down below or reach out to me. I'd be more than happy to talk to you. Okay, take care, stay safe, bye.